व्हाइट पेपर नहीं है ठीक है हाँ व्हाइट पेपर అదే ట్రైనింగ్ ఫస్ట్ ఎయిడా
ఈ సెకండ్ హ్యాండ్ వెయిట్ చేయాలి ఇది వైఫై సార్ వైఫై పాస్వర్డ్
एक ही दिन में कम हो जाएगा एक ही दिन में होगा आराम करो दवाई लो तब ठीक होगा
బంద్ చేసుకోరా బాబు
ठीक होता है
మైక్
कर देना चाहिए एक के दिन में हाथ तब भी दौड़ा मारा था
Continue with our OHMS Industrial Safety Series. Our topic for today is First Aid. Shall be taken by Dr. Rohini Sakpal. Shall be covering wound, fractures, sprain, CPR, burns, external bleeding, and it will be followed by questions and answer sessions. Let's quickly go through the agenda. Virtual inauguration by Dr. Sundar Kataria, invoking the blessings of divinity, chanting of Gayatri Mantra. Introduction of speaker. Presentation by Dr. Rohini Sakpal. Questions and answer sessions. Closing session. Sadgun Sangh, conceived and led by Dr. Sundar Kataria, drive mission to elevate the quality, safety, and environment awareness levels of industry. Sadgun Sangh is a series of educative, informative events aiming illuminate professionals on possible solution to current is industry and economy. AMIE, Honorable Doctorate of Business Management. He started his career in building India's first nuclear power plant at Rawalbhata, Kota, Rajasthan. He contributed in developing India's first oil and gas field at Bombay High since its inception. He was head of industry and offshore development with DNV for 2 decades. He is founder of first Indian conservative assessment and inspection body known as International Certification Services Private Limited, which is a provider of total quality solution under single umbrella with wide spectrum of services. Lifetime Achievement Award of NACE Coron, received several national and international awards. I now request Dr. Katari.
कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः
Rohini Sakpal. She is the Deputy General Manager of ICS Assure Services Private Limited. Her academic qualification is BAMS. Her area of specialization is more than 10 years of experience in insurance claims, which includes working with health insurance sector to analyze the case and conclude whether payable or not, to do cost savings and detection of fraud. She has 7 years of clinical experience, including her own clinic and RMP at Territory Hospital. Please welcome Dr. Rohini Sakpal. Over to you, madam.
Hello. Ma'am, I request you to unmute. see your screen also, and you can see yourself and presentation. Ma'am, I request you to log out from your other device. Hello. Ma'am, you can just log out from your other device. Hello, ma'am, you can start, ma'am. We can't hear you, ma'am. Ma'am, you can start, ma'am. We can't hear you, ma'am. Hello, ma'am, we are not able to hear you. No, ma'am, we cannot hear you. Hello. Hello.
11:30 बजने वाला है।
Ma'am, in your mobile, no, you are logged in from your mobile also as Dr. Rohini. So in your mobile, unmute yourself. We are sending you an unmute request from your mobile. So Dr. Rohini, unmute. Yeah, you just unmute her. Over there. Have you received that request, ma'am?
No.
Ma'am, from your mobile, you log in again.
डाल दो हल्दी, थोड़ा ठंडा ही देना था, गर्म मत करना।
थोड़ा ठंडा ही देना, ज्यादा गर्म मत करना, पीने में टाइम।
मेरा मोबाइल आई कैन नॉट एंटर फ्रॉम माय लैपटॉप।
हाँ वो मेरे को भी, मैं यहाँ से ट्राई किया तो मुझे भी आया कि किसी अटेम्प्ट किया है तो ब्लॉक हुआ है करके।
सब लोग रॉन्ग अटेम्प्ट कर रहे हैं, सारे तो हीरो हैं आपके पास। किसी ने नहीं होना चाहिए सबके पास पासवर्ड, पासवर्ड को ऐसा कर दिया जैसे
Ma'am, you can display the screen PPT. Ma'am, we cannot hear you, but
मोबाइल पे उसको बोल zoom in your mobile.
in your mobile, ma'am, the Zoom is open. So from there, you unmute yourself and speak it from there. Ma'am, you can log in from your mobile also.
चलो आगे देखते सुनीता।
लोग है।
One is having Hello. Ma'am, you can just talk.
Oh, can you hear me all?
Yes, ma'am.
Thank you. Thank you. I'm very sorry.
Ma'am, you can please go ahead, start with the presentation.
Can you please share my PPT because I'm not able to do it on mobile?
One second. Ma'am, you can share the PPT from your laptop. I mean the desktop.
Okay, okay, fine.
Only share the PPT. Don't unmute yourself over there.
Okay, ma'am. Thank you. Just give me a second, please. Huh?
Yes, ma'am.
कल थोड़ी देर पहले तो वहाँ गया था सब अब क्या करें अभी तो
Hello.
लग
The topic for today's session is wound, fracture, CPR, burns, and external bleeding. So, what is first aid? The basic for the first aid is that there are three basic.
You can make the presentation to the full screen, please, ma'am.
Yes, it is there for the full screen. Can you see me now?
Yes, ma'am. Just click on F5 button.
Okay.
F5. It will come to the full screen.
I am having the laptop. Laptop is there is yeah. Okay, fine. Got it.
Yes, ma'am. You can continue.
Yes. So there are three basic C's to remember. That is check. You have to check the patient, call in case of emergency, and take care till the ambulance is there. So it is there like preserve life, prevent deterioration, and promote recovery. So in first aid, there are three C's, three basic C's and three basic P's to remember. Preserve life, prevent deterioration, and promote recovery. Now, what is wound? So wound is an injury to living tissue caused by a cut, blow, or other impact, typically one in which the skin is cut or broken. Now here the causes for wound is that by something sudden, something like cut is there, or due to fall or a bad knock. Cut, grazes, and lacerations are all examples of wound. Cuts are usually caused by a sharp object like knife or glass, or even a sheet of paper. Lacerations. In lacerations, what is there? That is a deep cut or a tear of a skin. They usually have irregular edges. That is when you see the patient and when you see that something has hit the patient, that means there is some tear to the skin, and in that that is border is not even. There is a irregular edges at the border. When you can understand it's a laceration, it's a deep wound. Now, the basic treatment for the wound is that you have to clean the area twice with whatever with the running water and the soap you have, and apply a bandage and ointment. So here for ointment, I recommend always betadine ointment, which is excellent, which gives excellent results in all the patients after cleaning. There is no need to use hydrogen peroxide or alcohol for cleaning. at home or at any workstation. If there is any injury, anyone can help the patient with the help of water and soap. Just clean the wound and give bandage and ointment. Continue this care until wound is fully healed. Deep or gapping wounds may need stitches or other wound care from medical professional. Now, there are different classifications of wound. I want you to understand the classification of wound. This wound is not that if someone has got hurt, is a wound. But there are certain classifications wherein you can understand that where the patient requires what kind of treatment. It requires immediate hospitalization, or for some time you can treat the patient at home. Now, abrasions. So abrasions is what? Abrasions involves a scraping of the outer layer of the skin against any rough or hard surface. If a person has got hit and it has only the outer surface has got some scraping, little losing is there. So you can understand it's an abrasion and not a deep wound. In this type of bleeding, there is no much bleeding, but the wound still needs to be cleaned thoroughly and prevent infection. Next is laceration. Laceration, which I explained you earlier, it refers to an injury caused by tearing of tissue. It's a deep cut usually caused by accident with the tools, machinery, and knives. In this type of wound, deep cuts are present and bleeding can be extensive. So usually in lacerations, the wound is deep and the bleeding is too much. Due to high force involved in the tearing of tissue, damage to muscles, tendon, bones, and blood vessels in surrounding area can be caused. Next is incision. Incision is what? It is due to a sharp object or tool. If an individual accidentally cuts themselves with a kitchen knife or a pair of scissors, it can result in an incision cut. Another type of incision is a surgical incision wherein the doctor cuts through the skin to gain access to the internal parts of the body for surgical purpose. So incision is generally for surgical purpose. Or if someone has done injury by knife, that is also called as incision. So your incision, it is going deep inside the skin. Next is puncture. A puncture is a small hole caused by a long or a pointy tool or object, such as nail. In some instances, a bullet can also cause a puncture wound. Though puncture wounds do not bleed heavily, but they can be dangerous and life-threatening, since they can damage the internal organs. So here in puncture wound, you cannot see that how far is the bleeding, what is the bleeding, because the bleeding is there inside the body. In avulsion, avulsion is a partial or a complete tearing away of the skin. This type of wound usually happens during violent accidents, including car accidents and injuries, inflicted by gunshots and exposure to explosion. These wounds may bleed heavily, leading to development of life-threatening complications. First aid of wound, as I explained you earlier, you have to first of all stop the bleeding. If you cut yourself, the first thing you should do is apply the pressure with a clean bandage or cloth and keep that part of your body elevated above the level of heart, if possible. Once the pressure is applied, do not repeatedly remove the dressing to check on the cut. Let it heal on its own. Clean the wound, as I told you earlier, with soap and water. Every cut has a potential to become infected. So, once you have controlled the bleeding, you should rinse the area with the tap water. So, for controlling the bleeding, you have to just give the pressure so that the bleeding stops. And once the bleeding stops, you can clean the area with tap water and soap. Use an antibiotic ointment, betadine ointment, which I highly recommend. Most people use Neosporin and betadine ointment also. Whatever is available at their place. Cover the wound. Once you have cleaned the wound, apply antibiotic ointment. Dress it with the sterile bandage. Sterile bandage is always available in the first aid kit. Change the dressing. It is very important to change the dressing frequently if the wound is draining quite a bit. You're draining quite a bit. That means you can understand that from the dressing which has been done at your particular location, if it is oozing, if the bleeding is there, if some water discharge is there, that means there is something wrong with that wound. The wound is not healing on its own. So therefore, here you will require to change the dressing. If it's relatively dry, that means it is healing on its own. So changing dressing once a day is appropriate. But if you see the oozing is there, the area is wet, that means the dressing is to be changed. Get stitches for deep wound. This can be done at the hospital sector. You likely need sutures if the wound is large, and if you can see the internal parts of that particular location, skin. So if fat is exposed, if muscle tissue is there, whatever you can see, that means it cannot be done at your end. So the patient needs to be transferred to the hospital on immediate basis. Pressure it so that the bleeding stops. Elevation isn't controlling the bleeding, then the wound is over the joint. Watch for the signs of infection. Now, what are the signs of infection in case of wound? That is redness of the particular location, swelling, pus or drainage, and excessive pain. And whenever, if the person is highly prone to diabetes, then immediate action is to be taken in order to so that the infection is not going inside. Now here, if you are in high risk population, that is, if you are if any patient is having diabetes or autoimmune disorder is a disorder wherein the immune system attacks the healthy cells of the body by mistake, or the injury is on your hands or feet. You should pay special attention to any signs of infection. Seek medical advice if you notice anything suspicious or the cut is not healing properly. Now here, most important is get tetanus shot. Everybody needs to get tetanus shot every 10 years. Most wounds we see are not tetanus prone wounds. However, if you get stuck by dirty nail or something exposed to dirt, those are most likely to be tetanus prone wounds. Make sure you have tetanus booster shot every 10 years as a general rule. If you get a cut, you want to make sure that you had tetanus shot within the last 5 years to reduce your risk of infection. Also, watch out the sign for hypovolemic shock. Now, what is hypovolemic shock? Here it means the patient is paler, cyanosis, unseen, weak, unrapid, irregular breathing, and weakness. So here the patient requires immediate help. This is the first state of the wound. That is how you have to. What all things you need to do in case of wound. It's a picture presentation so that you can understand very well. Stop the rinse the wound with soap and water. Apply the antibiotic. Cover it with bandage and check it every day. Now, when to visit the doctor? If it continues to bleed, if it shows particular signs of infection, that means if it is not a clear wound, you can see something white portion you can see, or something different is coming out of the skin. That means here suturing is required. Here, dirt inside the wound. There is a dirt inside the wound will not heal properly. It seems large. See, the wound is large and deep, therefore it requires suturing here. This fracture complete or partial break in the bone. Fracture is simply trauma, overuse, and is that the bone. The main pain. There may also be loss of functionality depending on the area affected. Treatment here involves is again resting of the bone in place, immobilizing, that means not to move the particular portion of that area of the body part, cast it or splint to give it a time to heal. And here many times surgery is required with rods and plates and screws so that the bone is in place. Now, what are the signs and symptoms of fracture? Anyone who has got a fracture, the patient cannot move his particular area of the body. He has got tremendous pain in that location. So pain at or close at the impacted area. redness you can see, loss of mobility. The person cannot move particular area like hand or leg, whatever is there. He cannot move particular body part. And sensitivity, that means if you touch the particular body part, he will not accept it. He will take your hand away. Sensitivity at or close to the impacted area. The sound of the bone grating against each other after the impact. You can hear the sound also. The sound of breakage or crack and the swelling. Now here, what is the first aid for fracture? It is very important. In case of any injury, follow the RISE principle. Now what is RISE? Just to make you understand, I have written it as RISE principle. So here R stands for rest. Rest the injured area. Don't make the injured area move or just to see how it is. No. Avoid movement to prevent further damage and don't put any weight for next 48 hours. Ice the area using ice compress for at least 15 to 20 minutes to help reduce the swelling. So you have to ice particular area for 20 minutes to see that the swelling is reduced and ease your pain. Stop any bleeding by applying the pressure to the wound with sterile bandage and clean cloth or a clean piece of clothing. Immobilize the injured area. Don't try to realign the bone or push the bone that's sticking back out. No. Let it be done by the medical professional only. Apply ice packs to limit the swelling and help relieve pain. Now, fracture and sprain, these both are altogether same, but little different is there in sprain. So I've taken this topic on. Now, what is a sprain? A sprain is an outstretching or a stretching or tearing of ligaments. A tough bands of fibrous tissue that connect two bones together in your joints. The most common location of the sprain is your ankle. Now here the initial treatment for the sprain is rest, ice compression and elevation. Now mild sprains can be successfully treated at home. Let us see what are the causes, how the sprain happens. At ankle, while walking, brisk walking if you're running, and if you don't see what is there around, or exercising on an uneven surface, landing awkwardly from a jump. For knee particular area, pivoting during the athletic activity. For rest, an outstretched hand during a fall. And for thumb, a skying injury or overextension while playing sports such as tennis. Here also the signs and symptoms will vary. And it may include pain. The swelling is of course there. Many times I have seen patients in sprain having swelling. Bruising is there. Limited ability to move the affected joint. Now here in fracture, the person cannot move the affected joint. But in sprain, yes, at least for some percentage, the person can move the joint. But there is a limitation to the activity also here. Whereas in fracture, there is no limitation. The person cannot move at all. Hearing or feeling a pop in your joint at the time of injury. Now, first aid for sprain is again rise here. Rest the injured part until it's less painful. Ice application. Wrap an ice pack or cold compress in the towel and place over the injured part immediately. Continue for no more than 20 minutes at a time, 4 to 8 times a day. Compression. Support the injured part with an elastic compression bandage for at least 2 days. So your compression is done by the bandage which we get at the chemist shop. So, do's and don'ts in sprain. Walking on a sprained ankle is not advised. Yes, when the person feels that yes, I can walk, but it is not advisable to walk. Why? Because they are indirectly causing tears again to the ligaments inside there. After the sprain occurs, it needs time to heal before weight bearing. Walking or weight bearing too soon may slow healing or cause further damage. Now your bandage. Why we have to apply bandage? It's the best thing to put bandage on the first thing in the morning and then take it off at bedtime. We are putting it bandage so that there is a less activity at the injured part. Now, ice application is a great choice for the first 72 hours after the injury because it helps reduce swelling, which causes pain. Heat, on the other hand, helps soothe stiff joint and relax muscle. However, neither option should be used for more than 10 minutes at a time. Application of ice. Now, why we have to apply ice? Because ice decreases the blood flow to an area which causes less swelling, whereas heat will bring blood flow to an area which can cause more swelling. So therefore, ice application is very important in case of swelling is there. Usually in first 2 to 3 days after an injury, we would recommend ice only. So please remember, in the first 2 to 3 days after an injury, you should do ice application. And you can put the ice on for about 10 to 15 minutes. Next slide is CPR. CPR is cardiopulmonary resuscitation. It is an emergency procedure consisting of chest compression, often combined with artificial ventilation, in an effort to manually preserve intact brain functions until further measures are taken to restore spontaneous blood circulation and breathing in person who is in cardiac arrest. So here, CPR is a life-saving technique that's useful in many emergencies, such as heart attack or near drowning, in which someone's breathing or heartbeat has stopped. So whenever the person is not responding, their CPR is important. Now, next, cardiac arrest symptoms. Well, there are often no warning signs before sudden cardiac arrest, but still there are few, such as fatigue or weakness, shortness of breath, fainting, dizziness or lightheadedness, heart palpitations, chest pain. Either of one signs we can see or none of them. Now the technique for CPR. Please understand the technique for CPR. Place the heel of your hand on the center of person's chest. Then place the palm of your other hand on the top and press down by 5 to 6 centimeter at a steady rate of 100 to 120 compressions a minute. Please note 100 to 120 compressions a minute. And it has to be 5 to 6 centimeter depth. In depth it has to go. So after every 30 chest compressions, give 2 rescue breaths. So after every 30 compressions, you can give 2 rescue breaths. It's a picture presentation here. So in first aid, you have to first of all call the emergency till the emergency comes. What all things you can do is check the vital signs. Check the vital signs, that is check the pulse sign. If you can understand pulse, how to read the pulse, or have to do just by putting your 3 fingers near the thumb line. Okay. Check the eyes of the person. Check if the heartbeat is there or no. If person is not responding to your loud voice, then you can start the first aid. Lift the chin and check the breathing. If the thing is that the person is not responding at all, start the CPR as I told you. by 2 hands. And after every compress, after every 30 compressions, here I have told you can give 2 rescue breaths. 2 rescue breaths. Again, you have to perform CPR and wait for the help. Next topic is burns. Damage to the skin or deeper tissues caused by sun, hot liquids, fire, electricity, or chemicals. Anything which is damaging the skin is called as burns. Now, here the degree of severity of most burns is based on the size and depth of the burn. I will tell you the severity of the every burn will be calculated. Now, electrical burns, however, are more difficult to diagnose. Sorry. Because they are capable of causing significant injury within the skin without showing any signs of damage on the surface. Sorry. Symptoms range from a feeling of minor discomfort to a life-threatening emergency, depending on the size and depth as degree of the burn. Sunburn and small scales can often be treated at home. Deep or widespread burns and chemical or electrical burns need immediate medical care. So therefore, the patient needs to be referred to specialized burn units. Now, accidental burns can happen to anyone, although children, teenagers, and older people are more prone to accidental burns. This age group are more prone to burn injuries from cooking, such as spilling a boiling pan of water onto the skin. Children and teens are also more likely to mess around with lighters, matches, and fireworks or get sunburns. Many things can cause a burn. Thermal sources, including fire, hot liquid, steam, or contact with the hot surface, are most common causes of burn. Other causes include exposure to chemicals such as cement, acid, or drain cleaners, radiation, electricity, sun, that is UV rays, UV light. Now, in the earlier slide, I've explained you that how the burn can happen. Now here, I will tell you that how to diagnose what are degrees of burn. So the first degree burn can be usually treated at home. They are very mild, most like sunburns. The top layer of the skin, that is epidermis we call, the top layer of the skin turns red and is painful, but doesn't typically blister, doesn't come out. It can be treated at home also. Second degree burn, here it affects the skin top and the second layer, that is dermis, lower layer. You may experience pain, redness, swelling, and blistering. Here it requires hospitalization. In third degree burn, usually it affects all 3 skin layers. Epidermis, which is the upper, dermis, again second layer, and the fat also. The burn also destroys hair follicles and sweat glands. Because the third degree burn damaged nerve endings, you probably won't feel pain in the area of burn itself, rather adjacent to it. Burnt skin may be black, white, or red with a leathery appearance. It requires immediate hospitalization. Now, symptoms I've told, burn symptoms vary depending on severity or degree of the burn. Symptoms are often worse during the first few hours and all days after the burn. It usually includes blisters, pain, swelling, white or charred black skin, and peeling skin. Now, how to measure burns? Anyone, you can also measure the area of a burn with the palm of your hand. In most people, the palm makes up about 1% of your skin surface area. So 1%, like this, one palm is 1% of your skin surface area. In general, if a burn covers more than 3 palms, so 3 palms means 3% or 3% of total body surface area of an adult, you should get immediate medical attention. For children, we say the guideline is 2%, that is 2 palms. I will go for treatment for the burns. Now, treatment by burn type include, now in first degree burn, again, running under cool water. Don't apply ice, immediate ice, lotions, oil, butter, toothpaste. No. Strict no to all this. For sunburns, always apply aloe vera gel if you are having at home. Or you can apply antibiotic cream. And you have to cover lightly with a gauze piece. You can also take over the counter pain medications. For second degree, treatment for second and first degree burns is similar. Your health provider may prescribe a stronger antibiotic cream that contains silver, such as silver sulfonazide, to kill bacteria. Now, elevating the burned area can reduce pain and swelling. You need to elevate the burn area so that it can reduce the pain and swelling. One can use cool compress on way to the hospital. Next is third degree burn. Third degree burn is a life-threatening condition and it requires skin grafts. Skin graft replace damaged tissue with the healthy skin from another of an uninjured part of the person's body. The area where the skin graft is taken from generally heals on its own. If the person does not have enough skin available for the graft at the time of injury, then a temporary source of graft can come from a deceased donor or a human-made artificial source, but this will eventually need to be replaced by person's own skin. Treatment also include extra fluids, usually given IV intravenously, to keep the blood pressure steady and to prevent shock and dehydration. Now, here are few preventions for burns. Burns have many accidents. Take these steps to reduce the risk of burn. How? You need to set your home's hot water heater below 120 degrees Fahrenheit. Always test the water in the shower or bath before getting in or bathing a child. Lock up chemicals, lighters, and matches. Use the stove's back burner as much as possible when cooking. Turn candles off pot and pans where they won't be bumped, and don't leave a stove unattended. Don't hold a child where you are near the hot objects such as stove. Set safeguards around the fireplace and never leave your child unattended. Install and regularly test the smoke detectors in your home. Stock your home with free extinguishers, fire extinguishers, and know how to use them. Cover the electrical outlets. Next is electrical burn. An electrical burn, here the skin burn that happens when electricity comes in contact with the particular person's body. When electricity comes in contact with your body, that can travel through the body. When this happens, electricity can damage the tissue and the organs. Now here, when the person comes in contact with the electrical source, have emergency services, do not touch the electrified person with your hands. Unplug the appliance or turn off the main power or switch. Try to remove the person from electrical source if you cannot turn the power off. Do this only if you can do it safely by standing on a dry surface such as rubber doormat or a pile of paper or books. Make sure you are not standing in or nearby water. Using a dry wooden object such as broom handle to push the person away from electrical source. Do not use anything wet or made up of metal. Check to see if the person responds to touch or being talked to after separating him. So you need to check the person whether he is able to talk after separating him or her from the electrical source. Electrical burns can affect the electrical activity of the heart and can cause heartbeat changes. If a person is not responding, you can start CPR. Rinse the burn with water. So what should I do about electrical burns that aren't so serious? So if it is not serious, the person is responding. So then rinse the burn with water and apply the bandage at the particular location. There may be burns where electrical current entered the body and where it left the body. You can call the doctor for immediate help. Don'ts in burns. Not use household products such as burn treatment. Many times at home, people use butter, ice, oil, eggs. No. The strict no to all this in case of burns. Do not remove clothing that is stuck to the burn. Do not pop, blister, or remove the dead skin. Do not use immediate cold water on the burn. Do not blow or breathe on the burn. Do not put the person's head on the pillow if their airway has been burned or something they have inhaled that is due to chemical burns. Do not allow the person to eat or drink if they have a severe burn. The last topic for us is external bleeding. Now here, what is external bleeding? There are two types of bleeding, internal and external. Internal bleeding we cannot see, but external, yes, we can see. So this is where the blood vessels and the skin are cut and the blood is escaping from the body. This bleeding refers to the bleeding that flows out of the body. Example includes nosebleeds and bleeding from the minor skin cut. Internal bleeding refers to the bleeding that occurs inside the body, which I told you now. This can happen following damage to an organ or an internal body part. Damage to the skin caused by trauma can be laceration, clean cut, abrasion, or avulsion, with the skin still hanging. Now you can understand the signs of external bleeding. A wound with or without an embedded foreign object, pain from the skin surface, bruising or discoloration of the skin, loss of normal function in an injured area. The skin can become pale, cold, and sweaty. Types of external bleeding. There are three types. First is arterial bleeding. I'll just go deep into it to understand types of bleeding. Arterial bleeding is usually the most severe. Blood may spurt from the damaged artery in rhythm with the victim's heartbeat. Venous bleeding can also be serious as the vein also carry high volume of blood. Capillary bleeding It occurs in all type of wounds. Now your arterial bleeding, typically bleeding from an open artery, is bright red in color due to high oxygen content. So here the bleeding is high to red, bright red in color. It is bright red. Why? Due to high oxygen level and spurts, which pulsates in time with the contractions of the heart. The pressure causing spurt also makes this type of bleeding difficult to control. As the blood volume drops, so will the patient's blood pressure drop. Eventually, the arterial spurting will decrease due to low blood volume. Next is venous bleeding. Bleeding from an open vein is much darker red color due to low oxygen content and flows more steadily. As venous blood is under less pressure, it does not spurt and is easier to manage as compared to the arterial bleeding. However, major venous bleeding, for example, burst varicose vein, can still be a life-threatening condition as large veins carry significant high volume of blood. Next is the capillary bleeding. It is bleeding from damaged capillary vessel is dark red and will ooze from the wound slowly but steadily. So here the blood is dark red and it will come out from the wound slowly. So slowly the blood is coming out. You can understand the bleeding is from the capillary bleeding. This type of bleeding often stops with no medical intervention as the body forms the clot. So by putting a pressure or high pressure on particular wound, the bleeding can easily stop. You can understand the bleeding was usually due to capillary bleeding. Now, how to stop the bleeding? Application of direct pressure over the bleeding wound stops blood from flowing from damaged vessels, giving platelets time to seal the vessel wall. Where possible, use sterile dressing directly over the wound and a gloved hand to apply pressure to the dressing. We're using glove hands so that infection doesn't go inside. Secure the dressing in place with the bandage. If the bleeding continues, leave the original dressing in place and apply another one on the top, securing with another bandage. It is good practice to always assess the pulse beyond the injury after applying the pressure dressing to ensure the bandage is not too tight. The rate of bleeding from an extremity can be subsequently slowed by elevating it above the level of heart. So it is advisable to keep it above the level of the heart. This method alone will not control bleeding, but when combined with pressure, it is a helpful condition. Put pressure directly on an outward wound with a sterile bandage, clean cloth, or even a piece of clothing. If nothing else is available, use your hand. Direct pressure is the best external bleeding. It's the best pressure for external bleeding, except for an eye injury. Please remember, it's not there for the eye injury. Maintain the pressure until the bleeding stops. Now, for how long time you need to apply the pressure? It has to be no longer than 30 minutes. From 10 to 30 minutes. Apply pressure until bleeding is under control. Maybe 10 to 30 minutes longer. Hold the dressing in place with bandage after bleeding is controlled. Never remove the dressing once it is in place. It's a flow chart for bleeding, external bleeding. External bleeding, first is apply pressure. Bleeding is controlled. If the bleeding is not controlled, then send for help. Use additional methods if trained. If the bleeding is there from the limb, apply arterial tourniquet. Bleeding control. Yes. By applying a tourniquet also, the bleeding is not controlled. You can consider for second one. Is the bleeding control? Good. If no, apply homeostatic dressing and needs to monitor the bleeding and wait for the medical help. Thank you all.
Thank you, ma'am, for such an informative presentation. Please put your questions in the chat box or you can unmute yourself and ask directly. There's one question.
What are the
What are
medicines?
the medicines required to keep it in first aid kit?
Yes. Yes. So in the first aid box, what I advise is sterile bandage is very important. Gauze tape is very important. Medicines, if you ask, you can keep betadine ointment. Please down betadine ointment is very important. To clean that, the cleaning of dressing with Dettol and Savlon. Apply Savlon and clean the wound. So Savlon is like if you put Savlon, you have to first of all clean that wound, and then again you can apply Dettol, clean the wound, and then you can apply an antibiotic, betadine ointment, and again put a gauze, then put a sterile dressing. And for painkillers, if you ask, you can take tablet Combiflam if you can keep it. Take Dolo 650 also, you can keep it in case if the patient is having, along with that, if the patient is having fever also, Combiflam tablet is sufficient. Okay. Otherwise, if the patient is allergic to particular medicines, better is to give Dolo 650, which is again paracetamol, crocin only, but having 150 more. So Dolo 650 is always on a safer side. Okay, and Combiflam is there if the patient is having too much of pain. And tablet enzoflam is also I recommend when the patient has got sprain. In sprain injuries, tablet enzoflam, only one tablet can reduce the pain and swelling of a particular injured part.
Hello.
Yes, sir.
Yeah, ma'am. I have one question. What is the key elements for the first aid trainings? What we can do in same training?
Which kind of first aid, sir?
First aid against any fire burns something.
Okay.
So what elements need to be reflected or need to be we can give in during the training when we give the training to the first aider for against the fire burn.
Against the fire burns, right?
Yeah.
Yes, sir. So here you can see I have given in my sessions. In case of burn, sir, you have to understand the severity of the burn, which I have told in my session. Okay, once the person understands how severe is the burn, depending upon the severity of the burn, the application of the medicines is to be there. I'll just go through it again. See, in case of burn, first of all, need to understand what is the severity of the burn. Burn can be due to any kind. It can be due to electrical burn or due to any fire burn. Okay.
Okay.
Then here, symptoms also you can understand, like I have mentioned, the types of symptom, the degrees of burn. Once the person understand what is the degree of the burn, it can be treated at particular office or at home. And if it is second or third degree burn, the person needs to immediately, you have to make the person reach to the hospital for next step. Never give water to the burned person. Never give. If it is a first degree burn, it is still accepted. But for second and third degree burn, it is not at all accepted. It is, we always give IV. The water, it is IV. So by IV we give, what dehydration is there, so we make it hydrate. But never give water by mouth to a burn person in case of second and third degree. Symptoms I have told you in cases of burn. The symptoms are there for all the three types of burns. Now here you are telling me that you have to measure the burn. So you can measure the burn also with the help of your palm, which I told you the palm rule. What is the percentage of the burn? Like how far you can treat the patient at the workplace, or immediately attention is to be done to rush the patient to the hospital. Now here, for any kind of burn, please note that you have to make sure that you run the particular burned area under the cold water. Now I have told that don't apply ice, butter, lotion, toothpaste, never. You can apply antibiotic cream here. So antibiotic cream, again I recommend betadine ointment here, or you can apply sulfasofa cream. Also you can keep at your first aid box for treatment of burns. And you can keep I told you, Comiflam tablet you can keep, or tablet Dolo you can keep, just to relieve, just to make sure that person is getting less amount of pain and the person can bear till the time of ambulance is arriving at particular place. First and second degree burns, the person, you can easily manage the patient. Second degree burns, still you need the patient to rush to the hospital, but yes, till the ambulance is coming, you can make particular treatment at your place. And for third degree burn, the person needs to be rushed to the hospital. Here
Okay.
I have prevention. Yeah, prevention also have to.
Okay, ma'am. My second query is, as per your presentation and the briefing, can we have the Combiflam or the paracetamol or the Dolo in our first aid book, or it is provided in this first aid books?
I recommend that the particular office or at workstation, these tablets is to be there. It is very important to keep these tablets there. And these tablets you can get at the medical chemist also, no need for doctor's prescription, because here we are not giving any antibiotic treatment. Antibiotic tablets are not there, because for antibiotic you need doctor prescription. But for Combiflam you can keep it. For Enzoflam you can keep it. For Dolo 650 also you can keep it at your place.
But ma'am, I am not the expert in this medical industry. So how I can get that? How many tablets and what will be the frequency I can give to the affected person? Because I'm not the expert. So if I am having same medicines in my this first aid books, so I can give the very
Sure.
give the major dose to the affected person. So
what we need, what we need to do in case of affected person, the person who has got affected, you can start with the first tablet. This is a SOS practice, is an initial practice which we are doing it in any kind of injuries. Let it be wound, burn, cuts. So everywhere pain is there. So for pain, you can start with Dolo 650 if the patient is having autoimmune disorder, or you can say Dolo, or diabetic patient is there. Okay, but if the patient is having no medication, is not under any medication, then tablet Combiflam is safe to use. Only one tablet I am asking to give till the patient reaches a particular destination of doctor. Then let doctor decide what is to be given next. For Enzoflam, when there is a sprain, for sprain injuries, it can be done at home also for treatment. Your just application of that bandages required, rest of the particular injured part. rice application, which I told earlier, and tablet enzoflam, which can be given twice daily. In my practice, I'll give it 3 times a day, but you can give it just twice daily. So all this tablet which I have told, enzoflam I have told, comiflam I have told, dolo also, you can give it 3 times a day.
Okay, ma'am. Thank you. Thank you.
Thank you. Thank you.
Madam, there is a question in the chat box. In
Okay.
an automobile industry having 100 employees, how many trained first aiders are required?
How many?
Trained first aiders are required. First aiders.
You mean to say boxes, first aider box?
Yes. Hello.
Yeah, ma'am.
It is asked by Harish Mango, sir. Mago, sir. Shall I repeat it again?
Yes, ma'am. Please repeat the question again.
In an automobile industry having 100 employees, how many trained first aiders are required? And another question asked by him is it permissible for that one trained first aider for external agency can train other employees in the organization on first aid?
With the presentation which I gave it right now, it is not that every like whatever explanation I have given, you can explain to the other employees. I think a doctor, I recommend a doctor is to be there to give the presentation for the first aid, so that we make them understand we can go in depth and make them understand. And about the first aid, if you're asking first aider boxes, if you're asking to me, so I recommend that for 20, if my 20 employees are there, I can give first aid boxes at my place. But if there is like 100 employees are there, so I think 5 to 6 a first aider boxes is to be there at my place.
Hello.
Yes, ma'am, tell me.
Ma'am, there's no question in the chat box. If anyone interested to put the questions. Okay, ma'am, we're moving forward.
Okay,
Thank you, ma'am.
thank you so much.
Our next session is on petroleum rules 2022. It shall be taken by Mr. Afzal sir. Paryavartan is an annual virtual exhibition and conference organized by ICS in association with SJKF Foundation. This year, we are going to celebrate Paryavartan from 2nd to 4th June. Here is our banner of Paryavartan with the theme Only One Earth. During Paryavartan, we will be having eminent environmentalists from various industries sharing their views and knowledge about sustainable environment. So do join us during the Paryavartan. ICS is pleased to provide you all its research and developments. Integrated Management System QMS, EMS and OHSAS. Excellence in Education Management ISO made easy in Gujarati, Marathi, Telugu and Hindi. For reading any of the above books, please contact Ms. Sushma. Feedback form. Please register on www.sadgunsang.org and go in your login and give feedback. On behalf of the Sadgun Sang team, I would like to express my gratitude to all esteemed delegates of the webinar for their presence and contribution to make this webinar a great success. Thank you.